Good evening, everyone, and welcome. I'm Dara Fruchter, the project manager for infant and maternal substance use prevention coordination on both the maternal and child health and prevention teams at the Maine CDC. As we kick off our two-day 2021 Maternal and Child Health and Substance Exposed Infant Conference, we celebrate a recently published book, Downeast, 5 Maine Girls and the Unseen Story of Rural America. We are very fortunate to have both Downeast author Gigi George and Director of MaineCare Services, Michelle Probert, with us tonight to talk about the powerful themes that run through this book, including the resiliency, hope, and success reflected in the portrayal of these 5 young women living in Washington County, one of Maine's most economically challenged areas and hardest hit by the opioid epidemic. Michelle Probert has been the director of MaineCare, Maine's Medicaid program, since early 2019. MaineCare currently provides healthcare coverage for 1 in 4 Mainers. Prior to Michelle's current position, she has held several others in Maine and beyond, providing and improving healthcare delivery strategies and systems with a direct impact on improving lives. In the early days of Michelle's career, she was an advocate for homeless families. Before we begin, I want to thank Marianne Haricall, the Maternal and Child Health Program Director at the Maine CDC, for supporting the purchase of 100 copies of Downeast, which will be mailed out to the first 100 registrants of tonight's event. I also want to encourage everyone to put their questions in the Q&A instead of the chat during the conversation. We're planning on giving time to questions during the end of the hour. It's now my great pleasure to turn the conversation over to Michelle. Thank you.
Great, thank you, Dara, and good evening, everybody. It's wonderful to have such an amazing crowd on a Monday night. Before I jump in, I always like to take the opportunity to give a little public service announcement about the Medicaid program and MaineCare specifically. So as Dara said, we cover about 1 in 4 Mainers right now, and Medicaid provides health insurance coverage to low-income Mainers to cover the cost of services, like, to name a few of the services that are mentioned in Downeast: prenatal care and delivery, substance use disorder treatment, behavioral health counseling, speech therapy, and other school-based services, just to name a few. And I also will take this opportunity to say, as I think it will be of interest to folks attending this conference, that within the next year, we're going to be expanding coverage to all children and pregnant women, regardless of their immigration status. And we will also be extending coverage for postpartum care to 12 months post-delivery. So those new coverage opportunities will take place in July and August of next year. But very, very excited to be able to provide critical services to more women and children and families going forward. So with that, I'm very excited to introduce Gigi George, and it looks like her Zoom name still says she's not Dara. There aren't 2 Daras. Gigi turned to narrative nonfiction writing after an extensive career in politics, public service, and academia. And on a different evening, I would love to talk to Gigi about all the other experiences that she's had, but tonight I will stay focused on the book. She's worked for the White House, the Senate. She's taught political science at Boston College, worked at the Harvard Kennedy School as program director, and has also led a national public affairs firm, which has resulted in commentary and research-based articles that have appeared in such publications as Time Magazine, New York Times, LitHub, Governing, and MIT's Innovations Journal. She lives with her family in New Hampshire, and she also lives with her family in Southwest Harbor, Maine, which led her, we are very happy to say, to the book Downeast, which I'll show everybody the beautiful cover so that you can see, and hopefully you'll be one of the lucky folks to get one of those copies. So as Dara said, and as the title says, this is the story of 5 Maine girls and the unseen story of rural America. It's the story of Willow, Vivian, McKenna, Audrey, and Josie, but much more than that, it's also the story of their families, their mentors, and the members of their communities who've made a difference in their lives, both formally as well as informally. I love the way this book interplays with the theme of this year's conference, which is sustaining communities through collaboration. This is not an explicit story about maternal and child health or the services that many of us work to provide, but it really is a story of the community and all the factors that are at play that we really all need to remember when we're thinking about how to design and deliver care in order to best serve. So that's enough of my little intro. Now we'll get to Gigi. So Gigi, you have worked and lived in New York City, Washington, D.C., Boston. I grew up in Maine, but on the opposite side of the state from Downeast in the Western Maine foothills. I grew up in a rural town with generations of largely Catholic and French Canadian families. And so a lot of this book really resonated with my own experiences growing up. But what I want to know from you is, how did you end up writing a book about the lives of girls in Downeast, Maine, given where you have lived and worked?
That's a great question, Michelle. And let me first, before I answer it, thank you for your generous introduction, and thank Dara for all the work and effort she's put into making this night possible, and all of those more broadly who have made this possible. It's such a pleasure to be here this evening, to join you in conversation, and to be with such a wonderful group of conference participants. I'll start by answering your question as best I can. How does a city kid end up in Downeast, Washington County, Maine, reporting on the lives of five extraordinary young women? I spent 4 years reporting this and 5 years in total reporting and writing this book. So it was a significant amount of time. I grew up both as a child and then in the policy work that I did for many years in urban places. I always focused on urban issues, largely education issues in urban places. And as I delved more and more into urban policy and urban questions, but then made a shift in where I lived, I opened my mind to questions about rural places. That happened about 15 years ago when my husband and we met and married in New York, and we were living in Manhattan. We turned to each other and said, we're ready for something different. My husband had spent a considerable amount of time in Maine for many years. And he had already bought the little place we have in Southwest Harbor, which we love. And I fell in love with it immediately, just as I fell in love with him. And we made the decision to move to Northern New England. I had never had that experience before. And we began to raise our daughter, who is now nearly 10. As we began to raise her, I started to have all sorts of questions about my perspective as someone who had been so urban oriented and what I was seeing in rural places, particularly Maine and New Hampshire. And I wanted to know more, and I especially wanted to understand more about how young people today were experiencing their growth in some of the more challenged places in rural Maine. And so I turned to a dear friend, the Reverend Scott Planting, who was then the head of the president of the Maine Seacoast Mission. And I knew that he had tremendous insight and experience, both from his ministering days and from his nonprofit work with young people, particularly in Washington County. And I said, how do I explore this? And he said, we were sitting in the offices of this mission in Bar Harbor, and he said, you don't need to go far to understand what's going on. Get in your car, drive up the road about an hour, and I'll introduce you to the high school principal in Downeast, Washington County, and the school superintendent of School District 37. And it all went from there. And I got to meet these extraordinary people, this extraordinary set of communities, and this place that, despite many, many challenges, has so much to offer in terms of lessons about community.
Great, thanks, Gigi. And with those lessons about community, there's a lot of these interesting tensions and dichotomy or apparent dichotomies in your book that sort of like work together. And with that, you know, there's a specialness, if I can say that word, about Washington County, but at the same time, there's a lot about Washington County that I imagine would tell you things about the rest of the country. So especially given all of your experience in urban America and then your experience in Downeast, like what would you say is special, and also whether it's the same or different, like what can that, how can we generalize that if we can to other parts of the country?
So I imagine, and I'm quite sure there are folks in the audience participating who know Washington County far better than I do from my experience there. And I'm sure that they would agree that there is something very special about this place, as there's something very special about Maine. And what I found in Washington County was, in terms of the natural beauty, something that is equally on par with Acadia, which, as I write, draws busloads and billionaires every year. That is stunning in terms of the land and sea and the natural resources that it holds. What is also special about Washington County, but I think is something that links to the question of what do we know about Washington County that is also can be drawn to other rural places, is that Washington County, like many rural places, has a tremendous amount of social capital in the face of tremendous challenges. And so that makes it special in the sense, I think, of how we think about rural places. So when we have a situation like Washington County, where you have tremendous poverty, tremendous childhood poverty, incredible difficulties, as you all well know, with opioid use, with the challenges of family structure holding together, and with the challenges that come with all of the difficulties, economic and otherwise, that come together, what you want to know is there, in the face of all that, a fraying of the social fabric, or is there something that is helping hold the social fabric together from the ground up, that makes those challenges not erased, but makes them in some ways easier to face together? And so what I found that was special was that connectedness, that fabric, was so tightly woven and so powerful that it was worthy of putting a megaphone to and exploring, as I did in Downeast.
That's great. And, you know, I think as I said, I grew up in Maine. I left for about 15 years and went to different parts of the country. And I also frequently felt that it's that connectedness and that smaller town feel that makes Maine special as a whole, although you certainly feel it more in certain communities than others. I also know that with that connectedness, Maine can be a little bit notorious sometimes, as you've probably experienced, about having a very strict definition of what it means to be a Mainer. So my daughter was born in Cambridge, Massachusetts. We moved, for me, back to Maine when she was about 15 months old, and her little brother, she's now 12, and her little brother likes to kid her that she's not a real Mainer because she did not spend her first year here, right? And so you hear about people being from away. And on one hand, I love that there's this pride Mainers have in the sense of place and in their roots. But then on the other hand, that's not always a very welcoming attitude, right? And it can be hard, especially when you think of individuals who are from away and come and really invest and make their lives and are dependent on this place. So I'm curious that given that you are from away and you're observing this community connectedness, did you feel that you were able to get like the real scoop from individuals and families and communities? Like how were you able to gain that trust?
So it's so interesting, Michelle, to hear you talk about your own experience as a true Mainer, having one child being quote from away and one being a true Mainer. So it happens, right? Even within families, immediate families. And I see that. I saw that over and over again. And I saw that whole interplay of folks who were from Downeast, and they would look at folks who weren't from Downeast, but were from another part of Maine, and they were considered from away. So there were all sorts of levels of being from away. And I, yes, in fact, was at the highest level of being from away, being a Brooklyn girl. So I went with some trepidation to meet these folks from Downeast, Washington County. I wondered, would they welcome me? Would they speak to me? Would they open up to me? And I have to tell you, despite this sort of reputation that surrounds Mainers, and I think is well earned in many respects, I was treated in such a wonderful way. I was welcomed from the start. I think that it was very much in part due to the fact that I had this principal, a Narraguagus High School principal, and the superintendent were just so open and so willing to extend their trust to me that when other folks saw that, I believe that gave me that sort of gold card, right? That is not always given, that said, you can talk to her and let's open up to her and let's have that conversation. And I am to this day so grateful for that, because it enabled me to spend such quality time with community members, and particularly with these 5 extraordinary young women who are at the center of this book. It allowed me to really get to know them and to be able to project and essentially serve as a tool to have their voices heard in a way that the voices of contemporary young women in rural places are not often heard. And I felt honored to be able to do that.
Absolutely. And, that focus on the girls and women in the book and how their trajectories are changing was really impressive. And I also, when you hear stories on an international scale that says, if you want to make a difference in a country that's developing or experiencing hardship, focus on girls and girls' education. And your focus in this book reminded me of that. And I'll just read a quote. I loved how it started out. So you said, "I realized that the greatest clues for what's to come in Downeast and in small towns across America may in fact lie in the hearts and minds of its girls. In a region that evokes images of boys brandishing pickup trucks and old salts hauling traps, it is Downeast girls who are most visibly wrestling with the growing complexity around them and forging new paths both within and outside their hometowns. Their stories parallel that of millions of rural girls who face a widening generational divide and a changing economic, social, and cultural landscape as they come of age and start to make hard life choices. Their choices will determine not only their own immediate futures, but also those of their struggling communities. In the case of Downeast, girls are, by and large, surpassing the boys in academics, sports, arts, focus on community, and general ambition in leadership, and are doing so despite big challenges. Even in lobster fishing, where boys still dominate, girls are making inroads. What forces are pushing them to thrive and succeed? How has growing up in the region shaped them? And how are they helping to shape the future of their hometowns? So I wanted to jump from there, which is very compelling. And I'm really curious about your thoughts of like, where does that trajectory go? Because Willow, Vivian, McKenna, Audrey, Josie, they're all Downeast, but they have different backgrounds. They have very real and heartbreaking challenges. And each one of them is inspiring in what makes them special and what makes them strive and move ahead. But I'll say that, a lot of the focus as they're growing up is like, who's the boyfriend, and do they have responsible for child rearing? And, there's these exciting inroads into lobstering and fishing, but the women are still not captaining the boats. And a career path that's common is CNA, and which is such an important position, but we know that, people who are certified nursing assistants struggle with having a livable wage and supporting their own families. So, do you think that this trajectory is going to lead to women having the same or better opportunities later on in life, while you're seeing that these girls are really the ones who are achieving while they're still in high school?
So it's such an interesting and layered question, right? Because I think in some respects you see in the stories of these young women, and I believe the stories of these young women are in many ways representative or sort of a microcosm of what you see more broadly in places like Downeast, Washington County. You see the way in which they each in her own way is taking on the traditions of the past, which they do honor and respect, and moving them or making an effort to move them forward with their own stamp. So for example, you have someone like Willow in the book who comes from a really difficult set of circumstances. She grows up in a household where there is substance use disorder, where there is physical abuse in the home. She moves 7 times before she's 8. She goes to live with one set of grandparents, and the grandmother is taken away while she's living there to prison on a felony count. So it is a very difficult set of circumstances. And as you and I'm sure many of the participants who are in the audience tonight know far too well through your work, it is far too common a story. However, I look at someone like Willow and I see the way in which she is not a victim. The way in which the social network, the connections that are a part of and at the center of this set of stories, the mentorship from the art teacher who says, you are a talented photographer, and helps guide her to understand that she has that value and to find herself through photography. The best friend whose family takes her in when she is at her lowest. The broader set of community networks, and yes, the networks that come from external places, right? That are whether they are government or nonprofit, they all come together and they help Willow recognize that she can find a path, not only for herself, but a voice in the community where she can emerge and contribute back. So taking that one example, and we can do this for each of the young women, but taking that one example as sort of the most dire of the examples, we ask the question that you then came to, which is, can Willow find that way where she is not just still on the edges of economic opportunity? And can she be both a full contributor to her community, which she loves so much, and someone who can sustain herself and her family together with her partner or not with her partner, right? Should that fray. My sense is, and this is anecdotal, my sense is, just based on these observations, that the opportunities could and should be greater, that there is more work to do in terms of economic development, in terms of opening the doors of opportunity. However, the groundwork has been laid in a way that I believe is not as often recognized as it might be. And that groundwork is based in the support of community-based networks that come largely from the ground up, where there is trust that is placed in them. And we can speak more to this. And where the folks, the young women who do aspire to do more, be more, reach higher, are able to do that because they feel that the safety net is real and that it's not coming from a place that they don't know and trust. And trust is such a big element in this. And maybe I'll pause there because I know there's a lot more to talk on this, but I do think that that is a very big piece of it.
So you just touched on a lot of things there, and I was taking some notes. So you were talking about the importance of these networks that also come from external sources, and community-based organizations and the critical role that they play, and that trust that needs to be established, which also loops back to our discussions of being from away and the trust that you needed to establish. So many of us, I imagine, here this evening, we are either in government or we're service providers. And right now is an exciting time, and that there's a lot of federal funding available to do lots of exciting things. But one of the quotes from your book, it hit a chord with me because it makes me wonder, like, do we have what we need to have an impact and to be able to stick around and gain that trust for the time that we need? And so some of those community pillars you were talking about were Manny and Lois, who are from the Maine Seacoast Mission. And you say, when Manny and Lois arrived in 2002, most locals were skeptical. They'd seen their share of nonprofits swing through these parts. Cadres of well-intentioned out-of-towners would arrive, armed with PowerPoint presentations and just enough funding to last a year or two before they'd have to start scratching around for more to keep their promises alive. Most were gone before anyone could recall what it was they were trying to do. That hurts, right? Because a couple of years of funding is a great opportunity, but then it's always the question of what's next, right? So what is your advice, aside from just making the money tree rain money? What is your advice to make sure that efforts in communities like Washington County have a lasting effect, which is part of that trust, is that you need to be established as well?
So the words of Manny and Lois just echo in my head so often as I think about questions like the question you just raised, and because it was right. It is a stark reminder of how, when nonprofits come in so well-intentioned and hopeful, right, and it's hard to have more than a couple of years of funding guaranteed, and so one sees the perspective from both sides. And I think that, based on my observations and based on the time I spent, what I see is this, that there were and continue to be a number of nonprofit efforts in Downeast, Washington County that really exemplify the way in which, when something works, it works. I saw that in the EDGE program through the Maine Seacoast Mission, which has found a way to marry both the ideas that pull the community along to places where it might not have gone, that really work on mentoring young kids, especially to see opportunities beyond what they might otherwise have seen, but did it and continue to do it in a way that reaches into the community and does not have, for lack of a better word, an arrogance about what they know versus what they don't know about what the community needs. It takes a great deal of humility. I saw that in Manny and Lois. I saw that in the work that they do, both with the EDGE program, which is the mentoring program, and with the Table of Plenty, which really provides the nourishment and sustenance for so many families who are looking for that next meal and don't always have it. What I also saw in some of the others, and one of the other ones that comes to mind is Mano and Mano, which is this wonderful, and many in the audience may know this who are from Maine, this wonderful nonprofit that serves largely the immigrant community, the Latino community that had started out coming to Downeast, Washington County through the migrant work of blueberry field work, processing plants, and other such jobs. These migrant workers came, and many have now since settled and become immigrant families. And Mano has emerged with this incredible leadership that has shown the way in which outsiders, quote, can come in, both outsiders in terms of being from away and outsiders in terms of not being among the vast majority of white folks who make up the population of Maine, right? And so, if you think about an organization like that and what it has faced, it has found that formula, and it isn't formulaic, but I think that the elements as I observed them were, again, making sure that they would build the trust with the broader community, showing the way in which it has a respect for the traditions of the community, but has a way to show that it too, the new community, have something concrete to offer. And then there is a lot on that theme, right? But then there is the age-old question of funding. And I wish I had a better answer on that, because I think that ultimately, right, that is sort of where the rubber meets the road. You can do all of these things in terms of trust building, in terms of showing that you are willing to listen before acting, and to showing that good faith. And in a couple of years, it's really difficult because you have to show that you're there to stay. And you need to do that, unfortunately, by showing that the funding stream will be there.
So I will say, this is a great segue. Part of what both MaineCare and Maine CDC are working on right now is how do we look at some of the services that we cover as MaineCare and build into that service model that community connection, but have that be part of MaineCare's Medicaid's coverage, right? So it's not a grant; it doesn't go away. This is a service that we pay for. It's a service that individuals get through their health insurance through MaineCare, and it will stick around. And so. Part of we have an initiative around community health workers, and those community health workers, by definition, I should have written out what the definition is, but by definition, community health workers have to be people from a community with lived experience of the people that they're serving. And so that could be a recovery coach who has been through substance use disorder and is in recovery themselves. It could be a community health worker who is from the migrant farm worker community and is now settled in Millbridge and is partnering with either a community-based organization like Mano and Mano or with a health center to help connect. And we're really excited about the potential here because it really helps build that trust and that connectedness that you're talking about, and also shows that an organization is recognizing the strength and the expertise of those who are in the community and doesn't have all the answers itself. So when you see, so I'm curious if you think that kind of model has promise, or if you saw examples of taking members from the community and really using their expertise to make that link between individuals and service providers.
I think it's a tremendous model to build off of, because it recognizes all of those things that we were just talking about. And I saw that over and over again. Another organization that comes to mind in Millbridge is WHRL, Women for Healthy Rural Living, which when you look at the genesis of it in 2004, and you look at the members of the board and the staff, it is overflowing with names of people from the community, women in particular, who have made a decision that they need to step up. And some of these women I'm thinking about, and particularly some of the younger women I'm thinking about, they went through some tough circumstances of their own in their own lives. These are not folks who came from backgrounds of, quote, privilege, but they made a decision with the helping sort of hand of an organization, of a structure, and a funding that, yes, comes significantly from outside. These women made a decision that they needed to step up for their own community. But I believe that they do that because they saw that they were going to be heard, that the concerns that they have are going to be, and this dovetails back to one of the broader messages of the book, which is that when we talk about rural places, and when we talk about all of the challenges that many folks face in many rural places like Downeast, Washington County. So folks who live in these places hear from the outside a dominant downbeat narrative. They hear that they live in places of hopelessness and despair. They turn on the television or click on the internet or listen to the radio or listen to their leaders, and they hear that echoing back to them. And I think that in many ways is self-perpetuating. And what I found, time that I spent among those in this community, in this set of communities, is that yes, there are challenges, but they have a tremendous pride in their place. They are rooted to the place they come from. They believe in the life of their small towns. They know that there is tremendous natural beauty and there are tremendous resources that help sustain them. And they work hard to sustain them and to sustain themselves through that work that is so tied to the land and sea around them. And so I think that it's incumbent on all of us, whether we're talking about this broader message of what we're reflecting back to rural places, or whether we're talking about the work of nonprofit agencies or government agencies in how we walk into places and talk to folks and encourage them to be a part of what we are offering, that it's incumbent upon us to reflect back some of that optimism and some of that pride, and not to view them or project that they are problems to be fixed. And I know that for so many who are here with us tonight, that is not how they approach things, that they do not view them in this negative way. But it is a good reminder, I think, for all of us to have in the back of our heads, because there is so much energy and so much belief in the life that folks in places like Downeast, Washington County have. And they will welcome the help if they see reflected back respect for who they are and what they have to offer.
So on that immigrant communities in Downeast, you mentioned mano and mano, and the fact that Downeast, as is the rest of the state of Maine, very largely white. You also just mentioned the words pride and hard work. And when you're talking about some of the migrant, often immigrant farm worker families in Downeast, you do talk about what they share with the broader community in the Downeast, which is that pride, that hard work, that faith, oftentimes, the importance of family. And you also share a brief story of Alexandra, whose family established themselves permanently in Millbridge and have really become pillars of the community there. But I imagine that, there are additional struggles that are really significant for those immigrant families. They're from away, again, with the added fact that they may not speak English or speak English well, cultural barriers, the nature of their work is itinerant. There's bias and there's racism in the US as a whole, as well as in Downeast. So what do you think when you look at Downeast and all of the folks who live and work there? What is going to help the region capitalize on the potential that these immigrant families bring with them? In the book, you say their new energy and distinct perspective. And what should, providers who are here this evening, the healthcare system, what should we all be thinking of to help the region really utilize the strength that these families bring?
It's a great question and an important one, and it particularly in Millbridge, but even more broadly than that, where you do have now immigrant families who are entering into next generations of children now growing up and having children, and they've gone through the school system and their children are now going through the school system. And it's fascinating to speak in particular to a number of young Hispanic women who were in their late teens, early 20s. I spoke with a number of them through the course of the reporting of this book. And as you mentioned, I highlight one in particular, Alexandra. And I asked them some of these questions because I too was curious about how they saw things either growing, changing, not growing, what was going on. And there were a number of common themes that came through. One was almost all of the young women said that the reason that their parents made the decision to raise them, to settle in Downeast, Washington County and raise them is, as you mentioned, that there were so many commonalities in how they viewed raising their family, connection to faith, belief in hard work, showing that hard work ethic, and for them, what they perceived as some opportunity, right? Some opportunity, despite the levels of poverty in these places. So they had faith that they could find their way. So that was a really interesting positive theme that ran through, that it was very much a conscious decision to come and stay. Now, language barriers, cultural barriers, it is clear that those continue to be things that the broader community and the schools in particular are grappling with. So it is not all perfect. And that is why it's so important that an organization like Mano and Mano is there working day in, day out, that its building is there and a symbol, right? That everyone sees that they are there to stay and to work in a positive way to bring the communities together and to advocate in a positive way. So that's an important piece of it. I did spend some time, in particular in Millbridge Elementary School, where there was a longtime principal there who has really made a tremendous effort, and she has shown the way in which they've gone from a place over a number of years where they really weren't meeting the needs of migrant and immigrant children, to opening up the school and opening up the practices to say, what are we doing wrong here? How can we be better? And it takes that kind of leadership. Right? It can't just be leadership from the migrant or immigrant community. It has to be leadership from the Caucasian community, right? The multi-generational community that says, what can we do better? And she exemplified that, and I saw that in others, and that those signals and those signs of reaching out and saying with humility, we don't really know how to do this. Please help us figure it out. Were such important signals to the broader community where you would not always find that. And I think it's a work in progress. It is clearly a work in progress, but I did see the seeds of a path because of the openness of leadership on both sides, from both sets of communities, to find a way. And you see the success as it's happening in this next generation of immigrant young men and women, particularly women, but in the men as well, who are now standing side by side in tremendous roles inside the community, in the business community, and in other respects.
Thanks, Gigi. I'm going to switch tracks to get in one last question before we go to broader questions. I want to give other folks the opportunity to ask as well, but we are in the time of COVID-19, and I can't have an interview at a health-related conference without bringing this up. I will say that this is the first actual book that I've read that talks about COVID, which was a little disconcerting for me, just because it somehow makes it like even more real. I don't know that you know, we are experiencing history as it's being written. And so you talk about how, you know, for the families and the girls in your book, the economy took a hard hit, which has its impact on social isolation and access to services and the whole outlook of the community. And so I'm just curious, have you kept in touch with families in the book as the pandemic continues, and how are they doing, and how are they coming back if they are?
I've been so fortunate to be able to stay in touch with the 5 young women. I am so grateful to them, and so pleased to report that they are all doing really well. And we've got this, we've even got a group text going. You know, I've learned that we communicate by text. So this is the generational, right, divide. But I'm honored to call them all friends, and I'm so pleased that they've been pleased with the way in which their stories have been told. As for the effects of COVID, yes, it was. So I was finishing up the book, the writing of the book, when we went into COVID spring, and I talked with my editor, and I said, you know, I really think it's important to include something about what's going on here. And it was interesting, just as a quick aside, that she agreed, although she paused for a moment, and this tells you what we didn't know back then. She paused for a moment and she said, you know, I think it would be really good, although will it be relevant when the book comes out? And here we are, right? Unfortunately, it's all too relevant. You know, let me do one quick example of the way in which it did affect a number of folks in the community, and particularly a couple of the young women who were involved in the lobster fishing industry. And one in particular is McKenna, this wonderful spitfire of a young woman who always knew she wanted to be a lobster fishing boat captain. And, you know, her dad and her brother agree to take her on. She's clamoring for it. And by the time she's 8, they say to her, okay, come on, you can do this with us and be a Sternman. And she's captaining her own boat by the time she's 17, and in many ways is one of those trailblazers. So there we are in COVID spring, and we're talking about what's going on, and and she was just dead worried, right? And her family and the lobster fishing families were dead worried about whether the lobster fishing industry would ever come back. Lobster is a luxury food. We go to restaurants to eat it. The restaurants were all closed. People weren't eating luxury foods. And so there was a real concern, and the capital that has to go into both establishing a boat and then maintaining the boat and all of the equipment that goes with it is tremendous. So you can lose your savings with just one bad season. I am happy to report that lobsters came back, and McKenna and her family are doing just fine, and that in particular those lobster fishermen who had been more savers than spenders, they are doing okay. But it was a scary time, as it was for all of us, but it was a scary time in terms of whether or not there would be viability economically and how they would survive the lockdowns and everything that came with everything that needed to be done.
I'm glad to hear that they're doing well, and that includes the lobstering. I was worried as I was finishing up the book. Great, it's been a pleasure speaking with you, Gigi, and I want to make sure we have some time for some audience questions. So Dara, we will turn to you for some questions.
Thank you, Michelle, and thank you again, Gigi. Yeah, we have a couple of questions. Gigi, here, a question for you from Anna. What has the reaction to the book been from the community?
So Anna, thank you for that question. I've been really, really pleased that the community broadly, to the extent that I have heard from them, and I have heard from many folks, has been so positive. And I spent some time this summer going back to Downeast, Washington County. I did a book talk at Porter Library in Machias, and I also hung out at the Jonesboro Grange. I was just had a lovely, lovely afternoon there, helping raise funds by selling books, helping raise funds for them for the many needs they have. And I was thoroughly moved with each visit by folks coming up to me and by folks saying that they felt honored by what was recounted in Downeast. And I owe a tremendous debt of gratitude to the 5 young women for allowing me to honor them and their community, because I really was just a vehicle for what they saw, for what they experienced, and for the love of the place they grew up, despite the many challenges. So I'm really, really pleased by the reaction, and again, so grateful to them all. Thank you.
I have another question for you, Gigi, from Michael. Earlier on in the conversation, you did talk about, how and why you were focusing on these 5 young women, and he's asking, I think in essence, sort of what's happening with the young men in Washington County, and why didn't they get more of a focus?
Yeah, great question. It's a question the question of what's happening with the young men is something that I get at nearly every talk that I do, nearly every encounter that I have where I talk about Downeast. And it is it's a difficult question to answer. In the course of my interviewing, I spoke with really ultimately hundreds of folks, either within or connected to the communities of Downeast, Washington County. And nearly every one of those discussions, I asked that question: what's going on with the boys? Because it's clear that something different is going on with them. And perhaps one clue that came out and that I recount in the book is when the principal of the high school of Narraguagus High, she and I were talking about it, and she said, the boys are not all doing poorly. However, I fear that in lifting our girls up, which is the right thing to do, that perhaps we've sent some of the boys a signal that they are somehow less than. And it was really food for thought. And I think it's a very worthy conversation. I wish I had a really good answer. And I sometimes say, and I have thought about this, that perhaps my next book or perhaps an article should be about exploring the question of boys, because I think they have their own story to tell.
Absolutely. Thank you. And Michelle, I think this question is for you. Going back to the conversation around when you mentioned that MaineCare and the Maine CDC were sort of in conversation around community services, and this question is connected to what that might look like in terms of prevention services becoming a billable service. So I don't know how much you can speak to that question or concept, but it was sent to us.
Sure, absolutely. So, I mean, first I will say that preventive services in the medical sense are absolutely covered, right? And so I do have to say that, because our well child visits and our screenings are all so important. And so those are absolutely covered. One of the questions I wanted to ask Gigi but didn't get to was around meeting social health needs, which are oftentimes called social determinants of health, right? And personally, if I think we want to do real prevention work, we really need to focus in on the things that Gigi talks about in her book, like making sure that people have stable housing and that they have enough food to eat and there are job opportunities and that there's transportation, right? Transportation is the key to so many opportunities. And I will say that there's starting to be a movement in the country of Medicaid programs getting to be a bit more creative about how can we potentially put funding towards those social health needs, and is that a good way? Does that make sense for Medicaid dollars to be invested in that way? And there's actually some national conversations going on that topic. And so we're not quite there yet, but I feel there's so much more recognition now about the importance of those factors than there used to be, and there are conversations happening. And so I'm hopeful that we'll be moving in a direction where it's not just about treating an issue that we as a society have helped create, that it's really about trying to prevent those issues more on the front end.
Absolutely, absolutely. Well, we are just about at 8 o'clock, and I want to take a moment to thank you both, Gigi and Michelle, for this conversation about Downeast and for kicking off our 2021 Maternal and Child Health and Substance Exposed Infant Conference, which begins tomorrow morning at 8:30. So thank you both again, and thank you everyone for joining us this evening.
Thank you so much. Thank you, Michelle. Thank you, Dara, and thank you all for tuning in tonight. The work you do is so critical, and I wish you the very best in the next couple of days and in your work in the future.
Thank you, Gigi, and have a great conference, everyone.
Take care.
Thank you. Good night.
Bye.